Okay, so here's part four, the final part. I'll talk about clinical summaries and then a case dilemma. Getting back to Beth with the thumb injury. Clinical summaries are what we're going to be using on the final exam. So clinical summaries we're going to be using on the final exam. For those of you who had clinicals over the summer, you probably did some version of this. It's just basically a summary of your treatment plan, what you found, what you plan to do in a very general sense. It has these components: the history, client goals, prior level, baselines, reason or cause of deficits, and then your ideas, your interventions, your expected outcomes, kind of your goals. This is a summary of components. It gives you an example. I'm not going to go through it in detail. Use it as your template, as your reference. We get into these different assignments. You have to do one for some other assignments, a clinical summary. So practice these, get familiar with these, look at these, ask me if you have questions. We've kind of been doing these all along. We're just kind of putting it together in a form of a narrative, basically. There's an example of one about the symptoms and all that. Again, it's what we've been doing. It's just summarizing it, generally speaking, in a narrative kind of format. All right, getting back to Beth. She's the one with the thumb pain. Thumb pain with the MP flexion, any kind of resistance of the thumb, buttoning, writing, holding onto heavy objects, snapping sensation in her fingers, index finger. So we're thinking the snapping could be early signs of a trigger finger. The thumb pain could be early signs of maybe stage 1 arthritis or just some inflammation. Probably in our CMC joint down in there. What could we do about it? Let's just jump right to the treatment box, show you how those kind of work maybe. So let's say the CMC. So we think it's arthritis. We've done our grind test. She has some deformity in there. I'm thinking she may have some arthritis, and we're going to treat it for that. Pain with pinching, resistive activity, she kind of has that. How are we going to treat it? Contrast baths. What do we mean by that? So we're going to have her do some cold and then heat. So ice it for 10 minutes and then heat it for 10 minutes. Kind of going back and forth. Heat, ice, heat, ice. You can do this in your sink in the bathroom. Put some ice cubes, cold water, and put your hands in there as long as you can stand it, really. And then do the opposite. Fill it up with hot water as long as you can, hot as you can stand it for 10 minutes or so. Go back and forth. It will calm things down in a hurry, make it feel better, get that inflammation kind of moving. Parapin baths, I think you're familiar with that. Can make it feel better. Something you can do at home. Splint it, the thumb spica splint. I think this would be very beneficial for somebody like Beth, especially if she's doing some wrestling, the thumb wrestling. So soft during the day, hard at night. So think of it like a neoprene, soft wrap thumb spica during the day when she's doing her activities, and then maybe stick it in a more restrictive one at night to get it to really heal and rest. Joint protection principles, everything around her joint, what she's doing, daily activities, avoid the heavy books, 2 hands versus 1 hand, all that stuff that's in the joint protection principles. Bags, a lot of young women have huge bags, students, big bags, got to be careful about that. Get some motion going with that thumb, pain-free, light resistive kind of stuff. Digit abduction, especially that second digit, build up the muscles, the base of the thumb, stretching the web space, all good things for her thumb. What about the trigger finger? Catching that in early stages, I'm guessing. We'll do our trigger finger test to kind of confirm our thinking. If that's the case, we could kind of educate her. We don't want you to be flexing the MP joint of that index finger. We're going to kind of limit that as much as we can, see if it gets that clicking, painful feeling to go away. Let's try this trigger finger splint right down here. Make one of these, relatively easy to make. So she would just prevent her from flexing her MP joint. You even tried it, a Band-Aid. Maybe do that before you stick a restrictive splint on her, just to get her mindset and thinking, I don't want to be flexing that finger all day. See if it helps. Try a gutter splint, especially at night. See if that helps. Again, some movement with the digits, pain-free movement to avoid surgery and all that. So that's kind of a plan from what we kind of learned, kind of applying it. What else we got here? We got your student led, keep up with that, getting into the thumb and all that, and quiz coming up and all that. All right, that is that. I'm not sure that's up to date next week. I'll have to check this right here. I don't think it's up to date. I'll have to fix that. All right, so the rest is good. We are good for this